pure aortic insufficiency is a common disease that is affecting up to 3% of patients above the age of 70 years. And many of those patients are not being seen as candidates for surgical correction, either because of significant burden of morbidities as well as the overall advanced level of frailty that prohibit them from undergoing surgical aortic valve replacement. Only 3% of patients with significant advanced disease undergo surgery if they have an ejection fraction of less than 30%. So our study here suggesting that TAVR might be an appropriate alternative in patients with severe significant disease who are not being seen as surgical candidates.
This video content is copyrighted by Mayo Foundation for Medical Education and Research.